up mga kaskwela? It's your Ate Nicola, ang atin yung chismosa. So now you are watching your favorite noontime show, Universidad Mo, Ibida Mo! So guys, who do you think is our new guest for this afternoon? What do you think is the course of our new guest from our university that we invite for today's chismisan? As we already invite the engineering student last show para ipakita at ibida na isa siyang nasyonal yan. Pero bago ko introduce ang ating new guest, bibigyan ko kayo ng hints kung ano nga ba ang ating pag-uusapan ngayong chismisan. So dahil buwan ngayon ng mga puso ngayong Pebrero, ay ating pag-uusapan ang tungkol sa kalusugan at ang sakit na diabetes. Dahil ngayong buwan ng mga puso, ay hindi ka lang magsasawa sa mga matatamis niya salita, pati na rin sa mga tsokolate at mga pagkain na binigay niya. So hindi ko na kayo paghihintayin, let us all welcome Miss Jansel Luarca. So, welcome to our university show, Miss Jansel Luarca, our representative from Bachelor in Science of Nursing. Thank you for wholeheartedly accepting our invitation, ma'am. It's my honor to be your guest po. Thank you for having me here. So, mga kaskwela, not make you wait any longer para sa matalinong at nakaka-inspire na informasyon na ibabahagi ng ating guest for today's chismisan. So, now, I will show you the objective for today. But before that, so now Miss Jansel, let us all begin our chismisan. In our question number 1, what are the characteristics of type 1 and type 2 diabetes? What are the complications associated with this condition? Okay, thank you Ate Nicole for your question. So actually mga kaskwela, the main difference between the type 1 and the type 2 diabetes is that type 1 diabetes is the genetic conditions that often shows up early in life. Or ang mga kadalasan na nagkakaroon nito is yung mga bata pang edad. And while the type 2 is mainly lifestyle related and developed over time. And when it comes to type 1, the pancreas does not make insulin because the body's immune system attack the islet cell that makes insulin. Kaya nagkakaroon ng diabetes. While the type 2, the pancreas make less insulin than used to, and the body's resistance to the insulin. Or in another term, it creates insulin but their bodies are resistant to its efficient use, or nagpa-fight back yung body sa insulin. So leaving excess sugar in the body stream, or that over time can cause to the damage to the numerous body's organs and system. So yan pala ang characteristic nila. Miss Jansel, regarding sa questions number 1, I would like to ask para alam ng mga kaskwela natin what are the risk factor in having these two type of diabetes po. Okay, so the risk factors for the type 1 and the type 2 diabetes. For the type 1 is that family history is the people with the parents or siblings with the type 1 diabetes have a higher risk of developing it for themselves, and also to age. So type 1 diabetes can appear at any age, but in the most common among children and adolescents. So dapat hindi lang yung mga matatanda ang mag-ingat, pati na rin ang mga bata. So in the type 2 diabetes naman is the risk factor is the people that have a pre-diabetes or slightly elevated blood sugar level. And for those people who are carrying excess weight or having an obesity and have a lot of belly fats, if you are physically active less than 3 times a week, and for the people who are aged in 45 and have an ever gestational diabetes, which is diabetes during pregnancy, and have an polycystic ovary syndromes or PCOS sa ating mga babae, and have an immediate family member with a type 2 diabetes, so pwede siyang namamana. And I will state some symptoms of having a diabetes, and these are urinating frequently, feeling very thirsty or drinking a lot, feeling very hungry and very fatigued, having blurry visions, having a cuts or sores that don't heal properly, having a very dry skin, having a more infection than usual, and also can experience irritability, mood changes, and unintentionally weight loss. So these are all the symptoms. So if meron kayong napapansin niyan and may assumption kayo na baka meron kayong diabetes, mustly visit your physician to get a check-up. So mga kaskwela, if meron kayong mga symptoms, better go to the hospital for check-ups. So okay, back to the number 1 tayo sa mga complication na pwede nating makuha if we have a diabetes. So go back to the question number 1, which are the complications that we can possibly get if we have a diabetes. So these are the cardiovascular disease, kidney disease, neurological conditions, teeth health, oral health, hearing, and the vision loss. So in the cardiovascular disease, too much cholesterol in the bloodstream can form a plaque on the damage of the artery walls. And in the kidney disease naman, over time kasi, high blood sugar from the diabetes can damage the blood vessel in the kidney. So as well as the nephrons, so they don't work as they should be. And in the neurological condition naman, which you can affect your hands, feet, legs, and the arms. And the feet health naman, which is the nerve damage, it can cause the loss of feeling of your feet. So, kaya diba kadalasan sa mga taong may diabetes, ang inaalala agad is yung paa. Kasi it's either puputulin ba or kaya di mo na mararamdaman yung paa mo. So, in the oral health naman, is high blood sugar can be weakening the white blood cells. So, white blood cell kasi, it is the main way to fight the infections na nag-occur sa mouth natin. And in the hearing loss naman, is over time kasi, high blood sugar levels can damage the small blood vessels and the nerve in our inner ear. And in the vision loss naman, is it includes in the diabetic retinopathy and the macular edema and the cataract and the glaucoma. So, ganun siya. Yung mga complication na pwede natin makuha kapag meron tayo ng diabetes. So, better mag-ingat talaga tayo. Mga kaskwela, we are just in the question number 1, pero ang information is too many na, diba? And nas nakaka-curious. So ngayon, we are in the question number 2, which is explain how diabetes can be managed using dietary adjustment, medications, and the physical activity. So Miss Jensel, the floor is all yours again. Thank you, Miss. So in the question number 2, healthy eating is the cornerstone of healthy living, with or without diabetes, right? But if you have a diabetes, you need to know that how food can affect your blood sugar level. Because it's not only the type of food you eat, but also how much food you eat and the combination of food type you eat. And we can manage our diabetes by adjusting our dietary. Because the food we intake had a lot of factors on how our blood sugar and the cholesterol will affect our body. So the things that we can do is we need to learn about carbohydrate counting and portion size, because the carbohydrate often had the biggest impact in our blood sugar level. And then make every meal well balanced. As much as possible kasi, plan for every meal to have a good mix of starches, fruits, and vegetables. But when it comes to your condition that have a diabetes, you need to talk to your doctor, nurses, or dietitians about the best food choices and appropriate balance of your food type. And also, coordinate your meal and medications, because too little and too much proportions of food might not be good to your medication. So, it's really need to talk to your physicians for that. And also, avoid sugar-sweetened beverage. Okay, so when it comes to the exercising naman, the physical activity is another important part of your diabetes management plan. Because when you are exercising, your muscle use sugar for energy. So regular physical activity can also help your body use more insulin more efficiently. So these are the factors work together to lower your blood sugar levels. And in medication naman, it can help to manage the diabetes, because as the insulins and other diabetes medications are designed to, So, over your blood sugar level when diet and exercises alone aren't sufficient for managing diabetes. So, but the effectiveness of these medications depends on the timing and the size of the dose. And medication you can take for conditions other than the diabetes also can affect your blood sugar levels. So diabetes can manage pala if we have a proper diet, we exercise, and we take medications. So thank you, Ms. Jansen Luarca. So but before proceeding our last questions, we are going to have a short break at magbabalik ang Universidad mo, ibida mo!
Yes, sir. Yeah, I'll be done
Beta.
today. Yeah. Ma, it's my boss.
See? Like father, like son. Always running around. And now my diabetes is also running out of control. Sometimes I also feel like running away, yaar.
Yeah, I'll be there in 20. Yes, sir.
Arey beta.
Sorry, ma. Very important meeting. Yes, sir.
Hello?
I hope you got the shoes, ma. Now you can happily run away.
What nonsense. But beta, what is this Ensure Diabetes Care?
Mom, it will help manage your sugar levels better. And your worries too.
But how did you know?
Dad was never good at keeping secrets, na, ma.
Come home soon, beta.
Diabetes isn't something you need to be afraid of. All you need is the right nutrition, exercise, and a little care. Ensure Diabetes Care starts working from day one and helps control blood sugar levels in 4 weeks.
So now we are back again still with our guest, Miss Jansel. So we are now in our third question, which is describe the possible effect of diabetes on pregnancy outcome and the approaches used to maintain glycemic control in pregnant women with diabetes. So the floor is yours again, Miss Jansel. Okay, so the question number 3 is diabetes during pregnancy, including the type 1 and the type 2 or the gestational diabetes, can negatively affect the health of the woman and their babies. So for the woman with the type 1 or the type 2 diabetes, high blood sugar around the time of conception increases the baby risk of the birth defect, stillbirth, and the preterm birth. And additionally, among the women with any type of diabetes, high blood sugar throughout the pregnancy increases the woman risk of having a cesarean delivery and increase the baby risk of being born too large and developing obesity or the type 2 diabetes in the futures. And these are some approaches used to maintain glycemic control in pregnant women with the diabetes, which are eat healthy food, but it needs a dietitian for the recommendation for the meal. Exercises regularly to keep blood sugar in control, monitor blood sugar often, and take insulin if needed, and get tested for the diabetes after birth. So I will state some of the food to avoid and the food that we can intake para naman magka-idea ang ating mga kaskwela. So, the food to avoid with the gestational diabetes is the food with a high in simple carbohydrate, such as the breakfast cereal, white rice, white flour, and the processed food or snack. And for intake naman, yung pwede natin kainin is the raspberries, blueberries, strawberries, spinach, broccoli, avocados, nuts and seeds, and the coconuts, then banana. And for all diabetic people naman, pwede natin i-intake yung mga broccoli, carrots, peppers, tomatoes, orange, melons, apples, banana, and the grapes. Wow! Thank you for your healthy and a lot of information, Miss Jansel. I can wait to see you serving as a nurse and our alumni in our university. Thank you again, Miss Jansel, sa pagpapaunlak ng aming imbitasyon. You're welcome po. It's really my honor to be here. So mga kaskwela, is another chismisan for today's, diba? So bago ako magpaalam, gusto ko lang magpaalala ngayong buwan na Pebrero, huwag lang puso ang ingatan pati na rin ang kalusugan. Happy Valentine's to all! And again, it's your host, Ate Nicole. See you again in another Chismisan session. Bye-bye!